Hi, Brenda with the Hospice Care Plan. Let's talk about doulas in end-of-life care. I feel it's more recently, there's always been death doulas, but recently they've become much more popular, in demand and important in the end-of-life process. Our company, the Hospice Care Plan, we collaborate with this wonderful group called the International Doula Life Movement, and they're a school that educates and trains doulas for end-of-life care. And I think the question that I kept having was why all of a sudden are we having so much more input and collaboration with doulas at end of life. Some hospices are hiring doulas. Lots of people are families are hiring doulas privately when they have somebody on hospice or at end of life. And I think it comes back down to years ago, the hospice was not part of the medical model. And then along comes palliative care, and then our symptom management really blossomed because our care was really research-based. And so I think palliative care has really improved symptom management. But what it did too is it made us more part of the medical model. And over time, that has become more and more. And we're having to function more like the healthcare system, which means we're busier. We need to see more patients in less time. In the old days, hospice nurses had time to be present, listen, ask questions, all those subtle things that go on at end of life. And case managers on hospice now are often, we're the hub of the wheel, managing the team, getting everybody that's needed in there, important symptom management. And there's simply less time, and the work isn't any less important. And it's the Pam and Anna at the International Doula Life Movement who really educated us on the importance and what the doulas are doing at the bedside and in the home. And they're not part of the medical team, although some of them do personal care. But they're a presence. They do lots of education. They do a lot of witnessing. They walk people through the death as the death occurs. They help with after death care. And the reason they're becoming so popular is there's a need. There needs more presence and time and end of life. It's partly why Nancy and I wrote the Hospice Care Plan, is we saw that there was lacking of education at end of life because you can't be at too many places at once. And the hospice teams are working hard and seeing a lot of people as more and more people are coming onto hospice. So I just really enjoy working with doulas. I find that their contribution to the team is invaluable, and their subtle presence ends up not being so subtle. And I really have admiration for those who are going into this field of work of being an end-of-life death doula. So if you feel like you're needing more assistance at the end of life with you and your family, first of all, ask hospice for more, and also consider Googling, doulas in your area, or asking hospice and hiring one privately. It's probably well worth the energy and money spent on them. So again, doulas are really changing and assisting how we die today, and consider using one. Thank you.